Okay. Respected brothers, Assalamu alaikum. I want to remind you all that this webinar is one of many with the purpose of teaching you all the necessary information for each field. I would also like to remind you all that this webinar will be available on YouTube. I would like to welcome our guest, Dr. Khizr Rana, who is a doctor with PhD in ophthalmology. Thank you for joining us, Brother Khizr Rana. Um,
Jazakallah.
Jazakumullah. I think to start off, can you please tell us a bit about yourself?
Yes, so I'm currently working in Adelaide as a doctor in the field of ophthalmology. Ophthalmology is a field which deals with all of the eye diseases, both medical and surgical diseases of the eye. And so that's what I'm doing at the moment. I'm originally from Pakistan in Mansura, and I was born there, and then came here in 1999 and then had my schooling and university education here.
Well, no, that's actually pretty cool. So now going to pursuing medicine. At what point in your life did you decide to actually pursue medicine, and what influenced that choice?
I think it was around year nine that I decided that. I'd considered other fields as well, like engineering and business, that I had also looked into. But then I kind of weighed up all of the pros and cons of each field, um, and that's when I decided that I wanted to do medicine, based on both the factor that you have a chance to influence the lives of others, and in addition, it's a field which is not boring, and every day you have different cases, different complex scenarios, and is intellectually quite stimulating, and intellectually it's challenging as well, but at the same time it is rewarding in that sense as well.
Oh, wow, that's actually a very great message I say to actually on the reason why I chose medicine. So can you explain why you decided to actually pursue further education, such as you said, like your PhD in ophthalmology?
So once you graduate from medical school, you work as an intern, which is like a house job, which they know it in Pakistan and in South Asian countries. And then
Yeah.
after your house job, you get a general job as a resident, in which you rotate around different wards, every 3 months or every 6 months. But then, if you want to specialize, particularly in any surgical or procedural fields, it is quite competitive to get a position into the training program. There are far more applicants than there are training positions. And so, in
Okay.
order to try and get a position within that training program, you need to do additional things like doing research and doing degrees like PhDs and masters. So, in a lot of the surgical specialties and in ophthalmology, doing masters or PhDs is very much required to be competitive. It still does not guarantee that you will get a position, but it does help your application. So that's the main reason why I did it.
Yeah. And for that part of the research, is that supposed to be like a practical research, or is it more of uh like a research based, like you find articles and then just make like a paper on that?
So it's all done based on practical research projects that you do and that you
Okay.
work on, and then from those research topics you can then come up with publications and then that can form part of your PhD. So it's practical research, not just coursework.
Yeah. Okay, wow. Okay, now going on to the education pathway to medicine, can you please describe the education pathway to becoming a doctor, including like the undergraduate studies, specialist training, and any additional certifications or exams?
There's two pathways. There's the undergraduate and postgraduate pathway.
Yeah.
Undergraduate means that you go direct from school into an undergraduate medicine degree, like a Bachelor of Medicine, Bachelor of Surgery, and then you do 5 or 6 years of that. And when you finish, then you graduate as a doctor. The other pathway is the postgraduate pathway, in which you do a bachelor's degree, often a bachelor's of science or health science, and then you sit the GAMSAT and do an interview, and then you try and get in. So these are the two main pathways, but with both pathways, the end product is the same, that you graduate as a doctor who works, as an intern.
Okay, well. So are there any like specific programs or opportunities available for high school students interested in exploring medicine?
I think a lot of high school students have the opportunity to do work experience, either in year 10 or year 11. And then I think that's one opportunity in which they can attach themselves to either a hospital board or a GP, and then they can see what it's like to be working as a doctor. So I think that's what I would recommend to anyone.
Okay. And also, how competitive is it to enter the field of medicine?
And look, I think as you know, that it is quite competitive. It's one of the most competitive fields, and so that's why they have put in additional hurdles like doing a UMAT, so it's called a UCAT now, and also the GAMSAT and interviews. So yeah, there's unfortunately too many more applicants, not enough spots, and
Yeah,
so yes.
that's true. But and also, what advice would you give to a high school student that is considering a career in medicine?
I think any high school student needs to first and foremost understand what it is like to be a doctor, and so not just go based off of what the impressions are of what medicine and what a life as a doctor is like. I think any high school student, before they make that decision, they should do some work experience, and speak to actual doctors about what day-to-day life is like. And then once they decide that yes, this is what they want to do, then they need to work towards that. Need to research on what their requirements are, what the university requirements are, and how they will end up trying to fulfill those requirements.
Okay, wow. Okay, now going on to your ATAR. So, how important is ATAR for entry into medicine?
ATAR is one aspect of your score. And certainly ATAR is very important. You need usually an ATAR in the high 90s to be competitive. But at the same time, there are some additional schemes in which students can get additional points. And it differs from university to university. So even if your ATAR is not, in 99, even people with ATARs, in the 90s, can also get into medicine. So ATAR is one aspect, and then obviously, as you know, there's the UCAT, which is also quite an important aspect, and that's often the gateway to get an interview. And then following that, you then have an interview, and then based on those three components, they weigh that up, and if you're high enough, then you get selected essentially.
Okay, so now following on the on UCAT, so can you please explain what UCAT is and what it actually tests for?
So UCAT, I mean, when I went through, it was the UMAT. It's essentially an aptitude test, which tests your critical thinking skills, and your logical reasoning skills, and your kind of empathetic skills as well. And they have a lot of questions in 3 hours time. It was that we had to answer as many of those questions. And there are different questions. There are some logical reasoning questions like patterns, and they say, what's the next pattern? And then there's some kind of reading, some paragraphs, and then answering questions from that. And then there are some other ones as well where you come out where they're testing your ability to understand, different perspectives and empathize and reason with those texts.
Yeah. And also, how long does the UCAT exam go for?
When I went through, it was 3 hours, but I'm not sure if it has changed recently.
Okay, that's okay. Are you able to like go into a bit more detail on each section of UCAT?
Look, when I went through, maybe it's changed now, but when I went through, there were three sections. So there was one section on logical reasoning, and where they had patterns, and they would ask you, what's the next pattern, and so you had to recognize what was the pattern that was going on, and then what was the one that would fill in that empty space. And then there was another section which was understanding people, and this was like a text of like a yeah, a scenario that they would present, and then they would ask you to various questions based on that scenario. And this was looking at your ability to understand emotions and understand different perspectives. And then there was another one in which they presented you like some scientific data, like a scientific text, a few paragraphs, and then they based various questions on that. And that was very much testing your critical thinking and your comprehension skills.
Yeah. Okay. Um, is there like any like any like training platforms available for UCAT or like or that you know of?
Yeah, I mean, there's a lot of websites and a lot of yeah, a lot of tutoring companies that have set up to train students for UCAT. I think exposure and preparing for UCAT is helpful. But I think at the same time, students don't need to spend thousands of dollars on it. There are some courses that they can do, online, and they can get exposure to those questions. And I think what would be good for students is speak to students who have got in, and like a medical students that are in first, second, third years, and ask them, what are the courses that they have used and which ones they would recommend, and then go based off of that.
Okay. And also, when would you recommend the students should actually start revising for UCAT? Like, for example, 1 or 2 years, or like, is there like a time frame that you would actually suggest?
There's no exact time frame as such. There are some people that might just do 1 or 2 months before the test and they will do reasonably well. And there are others that would study for years. But I think, a reasonable time frame would be, 6 to 8 months before the test. Just, starting to do some questions and becoming familiar with the type of questions. This isn't like a university exam or your normal high school exam where you've got a curriculum and the more you read up on the curriculum, essentially the more you memorize, the better you perform. This one is very much just becoming familiar with the format and the type of questions they have, and then applying that to the UCAT on the day.
Is there like any like so is there any specific percentile in UCAT that students should be aiming for?
Different universities have different cutoffs, but generally, they need above 80 percentile as a minimum, and above 90 percentile, I think, is very competitive. So anywhere in that range is required.
Okay. And can you please tell us like what was your study routine for UCAT?
So I, studied about 6 to 8 months before. So in the school holidays between year 11 and year 12, that's when I started studying for the UCAT. And then once school started, I obviously had subjects and school to focus on. So it occupied less of my time at that time. But yeah, I mean, just I think it would be helpful just to treat it as another subject, like you have, maths, chemistry, physics. If you're doing 3, 4 subjects, just have UCAT as your fifth subject, for example, and just dedicate a few hours a week to doing those questions and becoming familiar.
And also, would you say that time is a big restriction in like UCAT?
Yeah, I mean, they always have, more questions than they have time that's available. And so I think it would be helpful if for students not to get bogged up on, one question if they're not understanding it or I mean, it's all very, very much, doing practice exams and doing practice exams with a similar number of questions to what you will find in the actual exam to try and see how much time should I be spending per question.
And also, are there any other tips that you would give students on how to tackle the UCAT exam?
No, I think that there's no silver bullet as such. It's more so just a matter of practice, familiarity with the questions, and ensuring that you have your exam technique, which you will develop after you do a couple of practice exams. Then you'll get an idea of that.
Now, going on to the interview process, can you please tell us what the interview process is about?
Interview process is very much about trying to understand who you are as a person, and if they essentially want to see how you would cope with the demands of a medical degree and with the demands of a doctor, and what your kind of interpersonal and communication skills are like, because communication skills are very important in medicine, and so that's what they're trying to assess.
And are there any tips that you would give for students on how to tackle the interview process?
I think each university has their own interview process, and they all have different formats. What would be helpful is again contacting junior medical students who have recently gone through the process, and seeing if you can get a hand on any previous questions that have been used, and then practicing based on that, and looking at common scenarios and common themes that have come up, and just having in your mind, if this question came up, what would my response look like? I wouldn't suggest, people, trying to memorize word by word what response that they would have, because I don't think they would get the exact same questions, and I don't think it would come out that well. But you should have some of the broad themes that you would address under each particular question.
Yep. And is the interview process stressful?
Look, I mean, it is a high stakes interview, and so some people can experience more stress than others. So yes, I mean, it can be considered stressful, but that's one of the parts of managing stressful situations such as an interview, and that reflects on how you would then manage stressful situations when you're working as a doctor, for example, or as a medical student. So definitely it is stressful, but it needs to be managed as well.
Yeah. And how did you tackle your interview for medicine?
So I had the interview at the University of Adelaide, and so I had prepared with another student who was also applying, and so we had gone over some kind of common questions that have come up in the past, and then I had also written to prayers to Huzur Anwar and prayed myself as well for the interview, and Alhamdulillah went well, and yes.
Yeah, that's really good. Now going on to the pathways to enter medicine, can one pursue a career in medicine with a bachelor's degree in a different field?
Yeah, you can. You don't necessarily need a bachelor's in science or health science, although that is helpful for sitting GAMSAT. But yes, I mean, even if you have a bachelor's degree in some other field and you do your GAMSAT, then you can get in through that pathway.
And also, are there any specific courses or programs that individuals can take to enhance their chances of entering the field of medicine if they did not pursue it immediately after high school?
Like, what do you mean? I don't quite understand.
Like, for example, if they take any I say special training courses or like some special certificates that basically say enhances their I say cho like advances their ability to be chosen by that specific university into medicine. Are there any options like that available?
Look, I'm not aware. I think the most important thing is trying to do well in your GAMSAT so that you get an interview. So as you know, there's three components. First is your GPA, so trying to make sure your GPA is as close as it can be to 7, and then preparing for and doing well in your GAMSAT so that you can get an interview. I'm not really too aware of if there are any additional courses that could be helpful.
Okay. Yeah. So going on GAMSAT, can you please explain what GAMSAT is?
So GAMSAT is the pathway for those that are trying to get into medicine via the postgraduate pathway. And it is also, I haven't done the GAMSAT myself, but it is also a very long test. I think 2 times 3 hours of test. And then again, it's more extensive than the UCAT in the sense that it tests a lot of your knowledge as well of basic sciences. And in addition to that, it tests, your essay writing skills as well as your critical thinking skills. So it's much more extensive than UCAT, and requires knowledge of basic sciences as well. But anything more than that, I'm not too familiar with that pathway.
Okay. We're now going into the time span of the different courses of medicine. So how many years is an undergraduate medicine course compared to a postgraduate medicine course?
So undergraduate is either 5 or 6 years, and then postgraduate courses are 4 years. But then with those 4 years, you have to have a bachelor's before, which is often 3 or 4 years. So a
Yeah.
postgraduate course ends up being 7 or 8 years, and an undergraduate is 5 or 6 years.
Okay. Now going on to the areas of specialization. What are the different areas of specialization within medicine, and how did you choose your specific focus?
So that's one of the great things about medicine is that once you do medicine and you become a doctor, you realize that there's a vast variety of fields that you can go into. So broadly speaking, you can think of surgical fields, so doing surgery, and then you can think of physician fields, such as cardiology and gastroenterology and rheumatology. So these are physician fields that don't. Some of them, or most of them, don't have any procedural work involved. And then you've got primary care, so being a general practitioner, and then you've got psychiatry as well, and emergency medicine, and the other main field is critical care, which is like anesthetics, ICU, and emergency department work. So there's a vast variety of fields, and each field has their own advantages and disadvantages, and it's very much on what you feel like that you can best excel in.
Yeah. And also, are there like some qualities that are required for students that you learn during the course of medicine?
Yeah, so you were just cutting out a bit. I didn't quite get that question.
So are there some qualities required for students to learn during medicine?
Yes, I mean, I guess in terms of qualities, yeah, essentially, the qualities are first and foremost of organizational skills, and being able to prioritize your work. And then, you need to be hardworking and diligent and conscientious, so that if you have any tasks that you are given or any assignments, that you work through them. There is a very high volume of information that you need to process, so you need to be able to work through that in a systematic way, and in a way in which you can retain the most important information.
And now going on to the different roles available for medicine, can you explain or elaborate more on the different various roles that are available within medicine? And like explain like what they I say like check for or what their specialization is?
So essentially, you can think of it as each system has their own specialists. For example, if you think about the brain and neurology, you've got physicians, and neurologists are physicians, and they kind of assess neurological conditions, and they prescribe medications for neurological conditions. And then you've got neurosurgeons who deal with tumors of the brain, and they do surgery and they manage patients post-operatively. And so just like that, in each field, there are both physicians, the ones that are primarily involved in prescribing medications to treat disease. And then you've also got surgeons who also, prescribe medications, but they, in addition, also do surgical work as well. Such as, if you think about the gastrointestinal system, you've got gastroenterologists, and then who are physicians, and then you've got colorectal surgeons and general surgeons who do more of the surgical work.
Yeah. Now, going on to the job plus salary, were you able to choose which hospital you wanted to work as an intern after completing university?
Yes, I mean, do you have a preference system in which you preference different health networks? And then usually if you're a domestic student, you get either your first or second option in terms of the health network that you want to work in.
Okay, so by domestic, do you mean by like as an Australian citizen or by as like you living in the state domestic?
So there's both. So first and foremost, being Australian citizen, but then also being a local applicant. So if I'm living in Adelaide and I apply to the Central Adelaide Health Network, then I will have preference over an interstate applicant.
Okay, well. Now, can you please tell me what a JMO is and what their role is?
So the JMO just refers to like a junior medical officer. It's an informal term, but broadly speaking, it refers to intern and RMO. RMO stands for resident medical officer. And so both the intern and RMO are the junior doctors, and their role within the hospitals is, doing, it's mostly within acute hospitals and within larger kind of hospital settings. And they work within a team of other senior doctors, registrars and consultants, and they essentially are involved in the day-to-day work on the ward within the hospitals.
Okay, wow. Can you please tell me like how did you secure your first job after completing your education? Like after you actually fill out your form, like and then so what was the whole process of that?
Look, I think for those that are domestic applicants and local applicants, it's reasonably simple and straightforward. There's just an online application that you fill, and they just offer you a place. So there's no interview, no nothing for us. So I mean, everything is everything is done due to your medical degree. So the hospital gets verification from the university that you have graduated and you have passed all your marks, and then they offer you a job.
Okay, wow. So what are the job prospects like for doctors, both in terms of employment opportunities and salary potential?
So there's very good opportunities for doctors. In fact, they have a shortage of doctors in most states, in particularly the junior medical roles. And so anyone who becomes a doctor, particularly those that have domestically trained, they usually don't have any issues in getting work. So yeah, it's very easy to get jobs because they've got a shortage, and they're actually trying to import doctors from other countries like Ireland and the UK. So they're trying to attract them to come here and work. And so if there are any local doctors who have got local registration, then they take priority, and they can usually get jobs pretty easily. In terms of the second part of your question about the salary potential, this, as a junior doctor, your salary is just what the government has specified. So, there's not much difference between hospitals. Junior doctors working here versus junior doctors working in New South Wales or in Canberra have reasonably similar salaries. And then, obviously, when you specialize, then, you do a mix of public work and private work, and then, your salaries can be quite varied depending on which field that you go into.
And is there like a typical starting salary for like a doctor and how does it progress over time?
A typical, starting salary would be around 80 or 90K for a junior doctor starting off, and then it progresses, as you get more senior, it increments accordingly.
Yeah. And going on like the job part, obviously. So is there like a difference between like working in rural and say domestic area or like more of a urban area?
Yes, I mean, working in rural areas, they've got very much a shortage of doctors there. and so you probably have more responsibility in rural areas because there's a higher, proportion, a higher ratio of patients to doctors, and you probably have a broader skill set as well because you have to manage a lot more because there's not as readily access to specialist services that you have in the metropolitan area. You don't have as readily access to imaging services. And so, yes, you as a doctor working in a rural area, your field of practice is a lot broader.
Okay. And could you describe a typical day in your life as an ophthalmologist?
I mean, if an ophthalmologist or someone working within the eye department, your work is mostly outpatients. So you do see patients in outpatient clinics coming in, and then you're examining them and booking them for surgery or doing injections into the eye or doing laser work. So that's your outpatient clinical work. And then in addition, an ophthalmologist also does surgery. So the most common surgery is cataract surgery. And then they would have, a couple of sessions a week of that as well.
Yep. We're now going on to like an organization that doctors have to sign up. So is there like a professional organization that doctors must be affiliated with to practice in Australia?
No, not. I mean, all doctors need a registration from APRA. So that's the mandatory registration. Apart from that, there are different colleges from which doctors might like to register themselves, but that's optional in terms of which college you have an interest in. For example, if you have an interest in GP, you might register yourself with the GP college.
Yep. And also, what are the perks or benefits of signing up with your specific organization? Do you know?
So, I mean, you get access to professional development. So, for example, if they have lectures or they have courses, then you can get access to them to try and build up your knowledge in that particular area. And it also helps with
Okay.
networking and attending those events from other doctors who work in that area.
Yep. And then going into the work-life balance, how do you manage your work-life balance in the field of medicine?
Look, I think just as you do in any other area, it's just a matter of organisation and prioritization. Certainly in medicine, it's probably more worse than other areas because doctors often are having to work higher number of hours because of a shortage of doctors, as we were speaking about earlier. But it's very much a matter of organising yourself, having a calendar, having a schedule, and always prioritizing your tasks.
Okay, wow. Now going into the challenges, are there some challenges that you face in your day-to-day work as a doctor?
Look, there's always challenges. You're dealing with people from diverse backgrounds that have, that have medical issues, and so there's always challenges both from a diagnostic point of view and then also from a treatment point of view. But I guess this is the reason why you study for 6-7 years to become a doctor, so that you at least have a framework that you can use to address those challenges.
Okay. Now going into the misconceptions, like, are there any misconceptions about the field of medicine that you'd like to address?
Look, I think there is one misconception within the community is that doctors, have a very cozy lifestyle, and they, without having to do much work, they earn a lot of money. I think that is one misconception within the community. I think what I would say is that if your purpose is to earn money, then there are many other fields in which you can study and do a lot less work and earn a similar amount, if not more money. And those fields, have less risk associated with them as well. So, I mean, if that's the reason that you want to do medicine, then I would suggest that you explore some other fields, some other options that are there that you can probably do. Medicine, it requires a long period of study. To specialize often takes 15, 16, 17 years of training to get to. And so It's not certainly the path getting there is not easy, and even when you finally get there, it's not an easy, cozy job. There are challenges. It is a demanding profession, and so I think you just have to be aware that is the case.
Now going on to the part where you said that obviously it can take for specialization up to 15, 16 years. So for ophthalmology, for example, so are you still like learning about ophthalmology still, or are you a certified ophthalmologist now?
No, I'm not a certified ophthalmologist. So I'm currently applying for training programs because, as we discussed earlier, and the training programs are quite competitive, and there are a lot more applicants than there are training positions. So I'm in the part
Yeah.
where I am applying to be enrolled and accepted into that training program. And then once that happens, and then it will be 5 years after that that I then will become a specialist ophthalmologist after that.
Well, okay, now going on to the updated or staying updated on like the medical information. So how do you stay updated on the latest advancements and technologies in medicine?
I think you need to do reading, so keep up to date by reading journals on whatever area that you're interested in. It's not possible for you to be across every single development or every single area, but for example, if you're interested in gastrointestinal surgery, you would then read the relevant journals and ensure that you're up to date, and then also by attending conferences and meetings, you can become aware of the latest updates.
And on the conference, like on the part of the conferences, is it that like that it is compulsory that those specialists should attend those conferences to like excel in their field or to excel their uh learning capability, if that makes sense?
It's not compulsory. You do have to do some professional development, so that you need to, gather a certain number of points. And so, going to conferences is a good way to get those points. But there are also other ways. There's online training and online courses that you can do as well. So, conferences are certainly helpful for professional development, but they're not mandatory.
Okay, wow. So now going into the networking and the relationship. So how important is networking and building relationships within the medicine industry? Can this help someone excel far easier in this field?
So are you speaking to once you're a doctor, or once if you're like applying to get into medicine?
Let's say for both actually, like for two separate scenarios. So like for the first one, let's say for if you're applying to medicine.
Look, I don't think there's a significant need for networking as such within the medical industry. Aside from doing a bit of work experience and having an understanding of what medicine is like, I don't think that you need to have relationships with doctors or consultants, or you don't need to do networking with them as such to get into medicine. I don't want anyone there to think that because they don't have any doctors in their family, or because they don't have any connections with doctors, that they can't get into medicine. That's certainly not the case. The extent of your medicine connection should just be, having done some work experience and knowing some doctors from that. In terms of if you're a doctor, I mean, certainly you need to, particularly if you're wanting to get into, training programs, then definitely networking and, having good relationships with the doctors within those fields is beneficial for your applications.
Just going back to the interview process part, which we obviously talked about like I think 20 or 30 minutes ago. Can you explain like the difference between MMIs and I think it's a conference style interview type?
I think, I mean, the different universities have different interview styles, and so I would encourage you to just read up on that university, and they often have quite detailed information of what the interview will look like. But in general, the MMI refers to multiple mini interviews. They have multiple stations where you go through. In some places there might be 3 stations, and in other places there might be more, like 6 stations. And then in each station you have a different you have different interviewers in each station. Whereas the other interview format is like a panel interview where you might have 4 or 5 people there, some from medical related fields, some from the public, and then they all will ask you some questions. And so, both ways are seen within the medical programs. And so it's just a matter of kind of researching what is done in the university that you're going to apply to.
Yeah. So now going on to the memorable experiences, can you share any memorable experiences from your career that have had a significant impact on you?
Look, I think definitely, working within the ophthalmology area, our role is to try and help preserve and restore sight as best we can. And so, there was one situation in which I examined a patient, and I saw that she had a bit of clouding. So she had cataract surgery done, but what happens after cataract surgery, some years after, you can get a bit of clouding of the lens that has been put in. And it's very common for this to happen. And so when I examined her, I saw that her vision was a little bit down and she had a bit of this clouding. And so I offered her a laser procedure for that, to treat that. And so I got her in a couple of days later, and it's a very simple procedure that we do within the clinic using a laser. And we just essentially create a hole within that clouding so that patient can see better. And her vision, improved significantly post that procedure, and she was quite emotional and thankful for that. And I think so that was one of the good experiences that I had.
Well, that's amazing. So, just going back to UCAT again, I just want to ask, so when a student wants to study for UCAT, do you think it would be beneficial if they studied in like a group format, like having their friends who also want to do medicine, like I'll say like to better understand the skills and then like to better improve in UCAT? Like, what do you recommend that?
Yes, I mean, and then there are a lot of people that do it this way, that they do it in a group format, and then they go through 20 questions, and each question each question that someone gets wrong, they can then discuss with the other one and try and understand how their other colleagues came up with the answer, and so try and understand their thinking. So yes, I mean, if you do have a group, that might be beneficial, but a group doesn't work for everyone, and it's not a requirement, but some people might find it helpful.
Okay. And now for the finally, like the most important question, how has medicine provided you with the opportunity to help Jamaat? And can you please share some of your experiences?
I think medicine itself gives you the opportunity to serve the Jamaat kind of directly within international missions. And so there are different organizations within the Jamaat, like Humanity First, that do outreach clinics and visits, for example, in Sierra Leone or Guatemala and in other African countries. And so, and also the Australian Medical Muslim Association also does clinics in Malaysia. And so once you become a doctor, or if you specialize, if you want to specialize, you then have the capacity and capability to help out with some of those projects that the Jamaat has, either through the Medical Association or either through Humanity First.
That's actually really good. That's actually all the questions that I have for today. So is there any question from the viewers that they want to ask our guest?
Thank you very much. I don't have any questions. Thank you.
Okay, that's okay. So to actually end off our webinar, I would like to thank our guest, Dr. Kizarana, for joining us and giving us a great insight into medicine. And I want to remind our viewers to keep an eye out on our website for any future webinars. And Jazakallah for actually joining me.
Okay, no problem.
Jazakallah.
Jazakallah. Okay, Assalamualaikum.
Jazakallah. Assalamu alaikum.